Teresa said, my background is actually much more in the violence against women space, but one of the things that has brought me personally to this work is that we're grappling with the issue of scale. There's so many of the programs that we have developed that work quite well in terms of reducing violence still reach only a small geographic area. So how do we think about making a difference in terms of lowering levels of violence at a much bigger scale? And that's what brought us to thinking about what are platforms of work that are already going on that we could engage with and think about what are their implications in terms of reducing violence, and are there ways in which we can tweak these programs or do add-on programming to maximize both their positive impacts and minimize any potential negative impacts. So what I'm going to just do is give a brief overview. I want to do just a brief overview of social protection in general for the violence folks that are in the room, and it may be sort of a new area. And then I want to share some findings of a big review that I was involved in to try to systematize, okay, where are we? What do we know now? What are the questions, the big gaps in our knowledge, and sort of where do we need to go to better understand the potential benefits of cash programming and social protection for violence against women and children. And then I just want to offer a few quick ideas about next steps and where we need to go. So when I first came to this field, I found the language really confusing. So I just wanted to offer this sort of orientation to the language, that the biggest category of programming is called social protection. And that actually includes a lot of things beyond cash, right? So that's things including a country's health and welfare programs, insurance schemes, labor market policies, all of the things that a country has its toolkit to be able to protect people from shocks and economic challenges that they may face. A subset of that is called the social safety net programs. And those are actually the ones which people themselves get without putting money into it. So they're called non-contributory. So it means things where it's directly giving services to individuals. There are public works programs, school feeding programs, subsidies for fuel, things like that. And that's where you see also cash. And so a subset of social safety nets, right, are these idea of actually directly giving cash to families or to women or to adolescent girls or whomever in order to try to give them the opportunity to figure out how to use that and to maximize their benefit. Again, you'll hear this other piece of language in this field, which is conditional versus unconditional. And that basically means either you get the cash just because you have a child and it's a child grant program. There's nothing you necessarily have to do as long as you qualify for the program. Or it can be conditional, which means, okay, there's another program that you need to participate or a set of activities. You need to take your child to get immunized. You need to engage in a nutrition program. So this is the sort of wraparound programming, or you need to keep your children in school. So you are eligible as long as you do these other conditional activities. So one of the reasons that it's really quite an interesting moment is if you start to look at the coverage of these programs. Now, it's hard to see. So it starts at the top, for those that can't see, Europe and Central Asia. Like 84% of the population in Europe and in Central Asia have access to at least one of these social safety nets. Many of them have multiple kinds of social safety nets. All the way down to sub-Saharan Africa, where you see only about 13% of people currently have access to any social safety net that may or may not be cash. It might be one of these other things that we were talking about, right? But if you look at the growth, okay, this is another graph. You don't have to really look at the numbers. You just look at where the line is going, right? So what we see is social safety nets are really growing in Africa, and governments are really starting to commit to this type of program. So every country on the continent now has some sort of social safety net. And the average country in Africa has 15 different programs. So it might be school feeding together with cash and maybe various different other things. So it also, what we see is of the whole package of social safety nets, a bigger and bigger chunk is actually these cash distributions to families. So right now, cash transfers represent 41% of the overall social safety nets that folks are doing on the continent of Africa. So I just wanted to briefly bring your attention to this review that we did, and you can actually, I'm sure we'll give you these slides, so don't worry about it, but it was published in the World Bank Observer. We tried to get it in some place that the economists would think it was actually rigorous, and it is rigorous. But what we did is we looked at all of the studies that we could find that actually had any information about impacts of cash transfer programming on violent outcomes. Mostly what we're looking at is intimate partner violence. Some that are violence against children, but mostly right now our evidence base is largely about how does it affect couple dynamics in the family. And we looked at both quantitative and qualitative data. And what we were trying to do is not only say, okay, what do we know? What does it tell us? Does it go up, down? What do we know? But also, can we glean some ideas of the mechanism? So if giving cash is reducing violence, why is it reducing violence? And through what pathways is it reducing violence? Because if we could understand that, we have a better ability to understand how we might be able to tweak the program a bit so that we could really up that and get the most benefit in terms of its reductions of family violence. And then we wanted to then use this as sort of a platform to say, okay, these are the answers, that these are the gaps that we really all need to work on collectively. So I'm just going to take you through some really simple results from that review. And so we were looking at studies up to 2017, and what you'll hear today is a couple of studies that weren't included in this review, that have come out of sort of, this is the baseline, and so now let's start to add to the evidence. So of this, we found 22 studies that actually looked at, it had intimate partner violence, IPV, as an outcome. 2/3 of those were either conditional cash transfers or conditional cash transfers plus some other kind of programming. Most were targeted at women, so most of the programs actually gave the cash directly to women. And the plus included a whole range of other activities. So some of them were participate in a nutrition training and nutrition group. Some of them were health service based. Some of them were education, so there was a whole range. But many of them had additional programming sort of built, not related to the violence, okay? They were there because they were trying to accomplish some other policy objective, all right? So none of these were designed or had anything to think, the purpose was not to influence violence. If it did, it was a secondary sort of unexpected result. So in terms of regions, and this really reflects the evolution of cash transfers and social protection programs over time. So 2/3 of the study were from Latin America and the Caribbean, because that's where this type of strategy started back in the late 80s and 90s. And it's only been slightly more recently that you've seen the emergence of this as a strategy on the continent of Africa, for example. So most of the programs were means tested, meaning that they weren't universal, so they were trying to reach the poorest of the poor families, or women, female-headed households, or households with orphans, or any kind of thing. But so they were means tested, and most of them basically were delivering cash monthly. So these were not so much one-off, we give you cash for 3 months in a humanitarian setting, but these were things where people could actually anticipate that the money would keep coming. Over half of them were government run, and the amount really varied. So some of them were very small, so 6% of what their consumption expenditures were, up to 50%. So some of them were real, a substantial influence on what that family could access. So in terms of impacts, what we saw is 11 of the 14 studies that had quantitative results actually showed decreases. And those decreases range from about 11% reduction in IPV rates, like in recent IPV, so in the last 12 months, to 66, like 2/3 reduction in that household in recent intimate partner violence. There were 2 studies that had mixed results, so it seemed like it might increase emotional abuse but decrease physical violence. And there were really none that were across the board increasing violence. And that was a real concern because the field has been aware that there have been examples in the past that as women have been given access to cash or employment services, that if they're in a setting where that's not yet normative, it can disrupt things and actually put them at risk. So we found that finding really important too, that it doesn't look, at least in these existing studies and these programs that have been in place a while, that you're not seeing an increase. The increases that we did see, though, were stronger for physical and sexual violence than for emotional and controlling behaviors. So it seemed to have the biggest impact on hitting, for example, and less on sort of the kinds of emotional or some of the other things that can happen in abusive relationships. So then the last thing we did is we looked at pathways. And so we were looking at 3 different pathways, and we looked at both what came out of the studies as well as trying to think about ways in which this cash might actually reduce violence. And we went to other parts of the literature. So we, for example, would say, if it's doing it by reducing stress, what do we know about the impact of households getting money on stress levels? And then what do we know about the impact of stress levels on rates of IPV? So even if the study didn't follow it all the way through, we were summarizing that and saying, does this look like a reasonable pathway or not? So we came up with 3. So one was sort of overall economic security and emotional well-being. The other was actually influencing conflict in the family over resources and over other issues. And then the third is sort of a woman's empowerment idea. And let's just briefly take you through this. And I know you can't see that, but the kind of general household thing, it's working. One theory is that it's working at a household level. You give money to the household, it increases food security, it decreases stress, it improves overall emotional well-being. You might actually see a decrease in alcohol use, for example, because of that, and that then the theory is violence would go down. And each step of that, there's evidence from the literature that suggests that yes, that is a reasonable pathway. And we saw that 4 of the quantitative studies and 5 supported this pathway. 5 of the qualitative. So the other one is this conflict. So here, this is like, especially, we think this may be operating in the really poor households, where what you see is women are having to negotiate every day for the money to go to the market and pay for the daily food. And that's always a source of potential conflict, right? Because the man may not have it, he may have spent it on something else, and so if you can get cash into her hands, that eliminates that point of trigger. And so we think that could go either way, depending on, you could either see it that decreased conflict over money or things would decrease IPV. If there's more money in the household, though, you could also think, well, maybe the guy's going to now use that money to go drink or gamble, and that could increase conflict. Interestingly enough, we did not see that pathway. So again, that's sort of consistent with not seeing increases. So even though people are concerned about money going to what they call temptation goods, there's no evidence in the existing literature base that really supports that as being a big problem. And so that's also an important finding. This is just, it gives you quickly, it said, you know, there were many fights because of all the needs and that there was no money, but now that we have some money, we don't fight so much. So, you know, you see that a lot in the qualitative. And the final one, and this is one I think that's very interesting to people that work on gender, is this idea that in giving women more money and having them participate, for example, in groups and things, and having more respect at the family level or more respect from the community, that it would shift the power in the relationship and increase the woman's ability to, in effect, get what she wants for herself and her children and have more power. That, we think, tends to operate differently depending on how the man responds to that shift. So what you see is that some men say, oh, well, great, now there's more money coming into the family, I can see the benefit, and that's a good thing. Other men feel very threatened by that. And you can imagine, as with all the macroeconomic dislocations and men not being able to, be employed in the same way as they have, or work the land in the same way, that they can be quite threatened. And so then you can get a compensatory response where he's like mad that now she's bringing in money and that's my role. So it could increase or decrease. And so there's a large body of literature from other areas that suggests that this pattern exists, and it depends on the man and what's happening to him, and what's happening, and that then affects the likelihood of violence. So I'm going to skip that. So I think the takeaway messages are that we have some strong evidence that cash transfers are actually proven structural interventions right now to reduce IPV at scale. And so that's quite exciting. So we have 15, and now I've added in some of the things. So there's 15 experimental and quasi-experimental studies showing reductions. The focus, has been just on if it's happening or not. We have less information at this point about how it's affecting frequency or intensity. And we need to sort of look at cost effectiveness of these kinds of strategies versus others, or things that we can do to tweak them. In terms of what matters in terms of program design is we think these inter-household dynamics are really key, and we need to understand them more. So, how important is it that the woman retain control? And is it better to give it to the woman, or does that actually disrupt the apple cart, so to speak, and actually it's better to give to the household even if she controls it. And then we think that the plus components, meaning the other services, probably actually have a bit to do with not only achieving whatever the goal was, health or education, but that there's extra things that are also helping to reduce the levels of violence. So as she gets more autonomy, as she gets more mobility, as she engages in these programs, we don't yet know how much of it is the cash and how much of it is this. We know that the cash alone oftentimes has an impact, but it looks like it may actually have more of an impact when it's partnered with these other programs. So anyway, I'll stop there. That's sort of where we're at, and you can hear a little bit more about some of the programs that folks are now working on to try to take the next step and figure out the more pieces of the puzzle.
Thank you so much, Lori.